Okay, welcome to the next version or next episode of the Last Visit First podcast. Today I have a really special guest. Rexanne Domico is the president and CEO of Interim HealthCare, one of the largest and most respected home-based care providers in the United States. Rex brings more than 3 decades of leadership experience across home health, hospice, pharmacy, and post-acute care. Throughout her career, she has led operational transformation, mergers and acquisitions, in some of the most recognized organizations in healthcare. In January 2025, she stepped in as the CEO of Interim, where she is now leading the company's next chapter of innovation, expansion, and caregiving-focused growth. But beyond the impressive resume, Rexanne is also a dear friend of mine. We've worked together in multiple companies. She's one of the first people I call when I need a sounding board, a shoulder to lean on, or maybe just a good cocktail. Rexanne, welcome to the podcast.
Thank you, Tom. Yeah, as far as say, I'm not sure who's the better friend to who here, but we could debate that later.
Yeah, what Rex and I go way back. We've worked together in multiple companies. We've been on boards together. We've served together under the Vistry umbrella of companies, and it's been a blast. And we've known each other for many, many years. For the listeners that don't know you, Rexanne, and there's probably 1 or 2 in the whole world that don't know you, but give us your story. Tell us the backstory.
Yeah. So, gosh, thanks, Tom. I'm sure there's far more people who don't know me than that. But so, I started my career in the staffing industry many, many years ago, and then morphed into healthcare back in 2003 and started technically with Gentiva. Gentiva was the splitting apart of Olston Staffing and Olston Healthcare. So I ended up flipping over to the healthcare side at some point. And that's how I got started. I really knew nothing about healthcare, which was a blessing in many ways because you had the opportunity to be an observer and ask a ton of questions and start to figure out, what things were and what all these acronyms were and why things worked the way they did and why there were rules. I remember thinking that was really interesting. I said to someone one time, well, if it really makes good business sense, you can't do it. And that was how I defined, getting started in healthcare. But I've been in post-acute healthcare services pretty much the entire ride since I got started. I've been very fortunate to have the opportunity to work with a few great companies, spent a lot of time in the merger and acquisition space, in the operation space, in the sales and development space. So I've really been blessed to have the opportunity to do almost all of it at one level or the other.
And then somebody tapped you on the shoulder and said, we want you to run a home health pharmacy business. I remember that. And you said yes.
I know that's kind of funny. I did say yes. I thought, here's something I haven't done. Maybe I can figure this out. And sometimes, anything that you don't know a whole lot about can be real interesting, right? So it was still touching home health patients, though. I mean, that was the good thing. I did know what good looked like on the other side. So this is where Tom and I really got to know each other, I guess. He was one of my bosses on the board and then also just one of the people who really helped us work on our business development strategy and figuring out how we could, collectively start solving some problems in the industry, which the biggest problem we were really working on to solve there is medication management. It's still a huge problem today, but there is at least some opportunities for how we can collectively work with pharmacies and do that better than we've done it in the past. So yeah, that was a fun exercise for a 2.5 years, but we ended up with a really good result. We ended up helping a lot of patients and, figuring out a lot of really neat things about how pharmacy could do better, and work better for our industry, going forward. I even think that there's a chance that we may have helped automation a little bit. If you think about the fact that we talk about how this is done, your home health nurse goes out and does it. Our pharmacy tech gets on the phone and does it. The pharmacist reviews it. So figuring out ways to, just kind of make all that more efficient is also a pretty exciting outcome.
The other positive of that, Rex, is we got an amazing team, and you and I both have tons of respect for a man named Ron Malone. Where did you meet Ron? And I know he was back in the Gentiva days, and then I know you guys have worked together a bunch. And Ron's, I know he's your biggest fan, and as I am. But both of us love Ron. And tell some stories about Ron.
Oh my. So, I might need an agent here or something, But Ron and I got started. I was a sales rep for Olston, so it goes further than Gentiva, actually. I
Wow.
was in sales in a branch, and he walked in one day and introduced himself as our new area manager. So, I had the opportunity to sit down and spend some time with him. And then I think I was the person who probably just aggravated him day in and day out. Like, can you get here early? Can you make the sales call with me? Can you help me with this proposal? Help me jump my car off that won't start. I mean, like, you name it, there were just tons and tons of learning opportunities. And what I would say about Ron is I knew Ron when Ron certainly wasn't the CEO of anything, or wasn't even the senior vice president of anything, or you were on that track. And, Ron never left me behind. He saw, thank goodness, he saw something in me that he thought was, coachable and developable, I guess, if that's a word. And he always provided a coaching opportunity. He always provided an opportunity for me to step forward and earn a new role. And, I'm certainly thankful for that. A lot of people don't get that kind of mentorship, along the way. But he was also always really careful to make me have to do it myself. Right. So, I could tell you a lot of great Ron stories, but I knew Ron when he had hair. How's that? We'll start with that. He had a lot of hair when I met him. He'll probably say
Wow.
that I was responsible for pulling a lot of it out, but I
For
don't know.
sure. Two of my favorite Ron stories back in the early days of Home Care Home Base, 2005, 6, 7. He was running Gentiva. We were trying to sell him software, and he'd come to Home Care 100. And I mean, I remember seeing him and his entourage. He always had 4 or 5 people walking with him, and they were walking from meeting to meeting. And he's one of those people that just intimidated you. And I've been all over
Right.
the world. I've fought wars. I've done all kinds of stuff. Ron intimidated me. And then we were on the board of Agape Care of South Carolina together. And during COVID, I bought a motorhome so I could still go to board meetings because you couldn't fly. So I drove this motorhome from Minnesota to South Carolina. Then I was going from South Carolina over to Nebraska to watch my son play basketball and then going home. And I called Ron, and it was COVID, and we didn't have a whole lot going on. And we spent 3.5 hours on the phone while I was driving this motorhome across Tennessee. And it was 3.5 hours of some of the best learnings I've ever had. I mean, we talked about everything. We talked about Austin. We talked about beds because he's in a bed business. We talked about hospice.
Yep.
He was telling me the Gentiva story. And I probably didn't say 50 words, but it was amazing. And I learned so much about Ron and who he is. And I spent time at his house and got to know him. And he's a wonderful man. And for all those people out there that are listening that have had an interaction with Ron, and I know tons of you have, you're a better person because of that.
That's right.
And he believed in you. He's the one that convinced you to come to HomeFree. He convinced you to go to lots of places. Yep. So he believed in you over and over and over. That's awesome. Yeah. Rex, like I said, you're the person I call for a cocktail, a good laugh, and all that. You're one of the most humble people I know. You're leading one of the biggest organizations out there now. You're still the same person. How have you been able to maintain that?
Yeah, it's an interesting question. I think my first response was, what's there not to be humble about, right? I mean, I've always been a worker. I've always just seen myself as, a very vital, important part of the team. Today, I lead the team. I just try to do it the way I would want somebody to do it with me, but always raise the bar. I'm always trying to figure out how we do it better, how we get, more efficient, how people feel better about being a part of what we're doing. I don't really think about it much of a way other than that. It's funny. I was with a teammate a couple of weeks ago, and we were talking about a difficult situation. And I said, well, I think this is what I want to do. And, we were coming up with a solution. He looked at me, he goes, well, you can decide what we're going to do. And I was like, you know what? I can. This is what we're doing. So, I think a lot of times I just keep myself shoulder to shoulder with the people who are doing the work and plow through and do it with them. And that's what comes natural to me.
Yeah, I also think you're a good listener too. I've known you for a long time, and you listen and you take advice and feedback, and then you process that and then make a decision. And that's as a leader in multiple companies, it's something that's really hard to do. And it's something I've had to overcome in my career because, I always think my decision or my reasoning or my thought process is the one that's right. And being able to listen to your peers and say, okay, give me your advice and let me hear what you have to say about this, the pros and cons, and then we make the decision together. And it's something I've always learned from you. And as I watched you through the boardroom, through the leadership, through, challenging processes with HomeFree and BrightSpring and all the other companies you've been a part of. I mean, you guys have gone through a lot of stuff, and being able to listen to your peers and make a decision is really important.
Collaboration has also just always been really important to me. And then not being afraid to own the decision. So if you can collaborate for a while and figure out, listen well, determine all sides of the story best you can, and then, kind of make a decision and own it. We all make a lot of mistakes. And I think if you're willing to own it, good or bad, you learn a lot from that. Right. So, yeah, I think accountability is a big, big piece of that. I hope that's one thing that, always exists in my work life is the ability to collaborate with people who are smarter than me, who maybe have done it where I haven't done it or have, done it and failed, and then try to take all that and just make a good decision and own it. So, at this point, that's the best recipe.
For sure. It's proven it works. I mean, even the smartest people, Steve Jobs said, you hire smart people and let them run, get out of their way. Don't try to tell them how to do their job. That's cool. All right. You've led some organizations through some serious growth. I think about the BrightSpring, the Gentiva, these companies that have grown what you're doing right now. And we'll get into all the interim stuff too, because that's our super interesting model that most people on this call don't understand. But you've led them through growth, acquisitions, transformation. What makes organizations scale successfully versus those that fail? What have you learned?
Yeah. So, I would say one of the things that I think made us the most successful at BrightSpring is that we did 18 in my tenure there, we did 18 transactions. We were not in the home health and hospice business. When I started there, we just had a goal and we just kept marching to it. And, we learned as we went, and, we were fortunate to just be incredibly determined. We just had no idea we couldn't do it. Right. And I think about, when I started in that business, we were, I don't know, it was probably a $350,000 book of revenue business, predominantly all home care. And then we had, a really nice rehab business. And as time went by, we morphed into a whole lot of other things. We more than doubled that number. And, we just kept pushing for where we were going. We had somebody pointed north, and then we just kept going for it. And it was, I think winning feels great, right? And when things are going well and you're winning and you're getting to the goal line and you're doing the things and you're building something, not much feels better than that, quite honestly. So, I was really, really fortunate to be a part of that, that opportunity. And then, that took me into the pharmacy space. And then, of course, doing some similar things here at Interim today.
It's really cool. Was there a mentor who had a significant impact on your career? We all have a mentor, and I know you're a mentor to a lot of people now today yourself. So, but was there one that really had an impact on you?
Yeah, we've already kind of let that cat out of the bag, I guess. But I would say that, that would be Ron Malone for me. And I don't know that we ever formally called it a, kind of a mentoring relationship, but I grabbed every piece of learning that I could grab, the good, the bad, the indifferent, you name it, what can I learn from this experience? And also, I think one of the things that happened along the way for me from that mentoring experience was the ability to watch someone else really change the trajectory of an industry, right? Like there were a few people in this industry who really left a huge mark. And Ron was definitely in that group of people who did that. And just to watch where they were going and what they could see ahead, but wasn't happening yet, and be able to, to learn from some of that so that you could execute it against it later was, a real gift. And I think a lot of times, there was a vision for, can we do a full continuum in the home? Was there a vision of things that, what all could really happen in the home and somebody age in place and not have to, really be in a facility? But it was hard to accomplish a lot of those things during that time. But yet, the vision was there. And as time went by, a lot of other people have really brought that vision to life, I think. So I think even just the opportunity to see where, people like, Ron Malone and Keith Myers and Mark Baiada and, just some of these incredible names where they thought that it was going to be, and then ultimately to be able to see that play out even a little bit later has been a wonderful experience.
Yeah. All those guys are just icons in our industry for sure.
Yeah.
And all of them are retired now, but they're all doing stuff. They're not really retired. Yeah. They all say they're retired, but Keith's still doing stuff. I know Mark's still involved. And Baiada, he's still, doing some of their other investments. And of course, Ron's on more boards than he's ever been, working harder than he's ever worked in his life. So,
right.
All right, let's talk about Interim Healthcare. So first 90 days, you became the CEO in early 2025. What did the first 90 days surprise you the most? What did you find?
Yeah, so I joined the organization in July of 24 as the COO, which was a gift. I didn't really know that I thought it was at the time, but it was a gift to come in to the organization and work with Paul Mastrapa and kind of pick up. He just laid some great groundwork for us. Our organization was struggling a little bit. We had probably, we had sold franchises to people without a really strong support network at the time. We'd lost our way a little bit. And I think that the network was discouraged really with, who we were as a franchisor. So, I think I put my ops and my sales hat on and said, the first thing I'm going to do is go on a listening tour. And I think the thing that surprised me the most was that the people who own these franchises and the people who have really laid everything on the line to be in this business, the needs were pretty much the same, no matter where you went. You could see that, that they had either a plan that wasn't working or a sales staff that needed to be developed or a business plan that needed to be, maybe addressed a little bit, or even just a good place to go for support where they could get answers quickly and work in collaboration with a team that would help them achieve their goals. And we were just falling down in a lot of those areas. So I think I was really surprised that it's a big organization and it still comes back to some of just the key fundamentals of running a really good business and being able to, work together, one foot in front of the other with people and execute on the things that really matter and then execute on the next thing and execute on the next thing. So I think, it was surprising to me that the fundamentals were still the key things that needed work. It was also surprising to me how committed people were who own these businesses. Like you would hear their stories about some of our franchisees are third generation family members. And you would hear their stories about their parents who started this or their grandparent who started. And it was just so meaningful. And it was really clear that there was a huge desire, to really serve their community. Like they know that there's a whole industry going on around them, but more importantly, they're just really focused and worried about what's right in front of them. How do I make a difference in, Topeka, Kansas? How do I make a difference in, Alexandria, Virginia? Like that's what they wanted to do. And I don't think I'd ever experienced that before where they were so focused on their communities and just being a fantastic business owner and making the difference like right where they were. So I think that was just, it was really eye-opening for me.
That's awesome. All right, 60 years of Interim. So healthcare companies come and go, regulations change, payment models change, technologies change. Yet Interim Healthcare has been around for 60 years. How proud of you of that?
It's really an honor. I'm extremely proud of it, and I'm extremely excited about it. I feel like I've got the opportunity to usher something in to a whole new, kind of way of doing things, yet keep all of the good things that have kept Interim, so unique. And it's really been an exciting couple of years for me. One of the things that I think has kept Interim around for 60 years is really the spirit of the people. And we still talk about the founder of the company. We have awards that we name after the founder. We have videos that we show. We bring things up in our newsletters. I mean, I think the spirit of a lot of these things are still alive. And I think we've done a really good job of harnessing all of the really good things and carrying them, into the future. We have historians here who will very quickly tell you if you're kind of off the path, if you're doing something that maybe, doesn't really fit the tone of the company or where we're headed. But we also have a lot of people with their eyes and their arms open saying, what's the future? How do we get better? How do we take what we have today, do it better, make sure that we continue to have a really strong foundation and be successful. And I also think, Tom, that a lot of really good decisions have been made along the way. There's been a lot of good stewards of the company financially to make sure, that we did things the right way, and that we, just continue to kind of work with a servant's heart first for the industry. And I think that's really carried Interim a long way.
In home health and hospice, growth isn't just about closing deals, it's about execution. I'm Jay Duty, Chief Operating Officer at Maxwell Tech. We work with operators and investors navigating mergers, acquisitions, and rapid growth. And we consistently see the same challenge. The deal closes, but the organization struggles to perform the way it had. That's where Maxwell Tech delivers. We specialize in post-acute M&A optimization, standardizing clinical and operational forms, redesigning care pathways, aligning workflows across disciplines, and leading enterprise implementations from planning to execution. Our consulting is focused on throughput, productivity, compliance, and technology adoption. So organizations don't just integrate on paper, they operate as one scalable platform. This is not slide deck consulting, it's operational execution. We help organizations reduce documentation variation, improve their throughput, and ensure clinical, operational, and technology strategies are all aligned, especially in today's environment of reimbursement pressure and regulatory scrutiny. If you're integrating, scaling, or preparing for your next phase of growth, we'd welcome a conversation. Visit maxwelltech.com or email sales@maxwelltech.com. From first touch to last visit, this is how organizations scale with confidence.
What's the biggest opportunity for Interim over the next 5 years? Is it selling more franchises? Is it growing the ones you have? And then tell us a little bit about the size and scale of the Interim brands.
Yeah, happy to. I think it's a combination of all that. We have, believe it or not, a lot of white space. We have opportunity to still bring new franchisees, into our network. We slowed down on bringing new franchisees into the network for about the last year and a half, just to make sure we had our support systems right. One of the things I say a lot about being a 60-year-old company is, one of the great things about Interim is that we're a 60-year-old company. One of the hard things about Interim sometimes is we're a 60-year-old company. So, we had things that we needed to refresh. We had things that we needed to, tech stacks, different things that we needed to really think about doing differently. So we've laid a lot of that framework now, and we're more prepared than we've ever been to support our franchisees. We more than tripled our support network with the support of our private equity company to just really get this right and position us for growth and the right level of new franchise development work out in the marketplace. So we're going to do a combination of things. We're going to expand our current owners base as much as we can. Many of them are doing one service or the other, or maybe they're doing two, if they'd like to do 3 or 4. So we're going to keep expanding in every market where we're able to expand. And then we're going to also obviously bring in new franchisees. And we think we've got a really good recipe for how to do that now and how to support them and not let them get in over their head. There's a lot of good lessons learned where if they try to get into too many things at one time, they're not as successful. So we want to see them be really strong and successful before they jump into, that next service line, because we do 4. So we do the personal care work. We also do home health and hospice. And then Interim started as a staffing company, a medical staffing company many years ago. And we still have people who provide a fair amount of medical staffing services. We even have some franchisees that exclusively do medical staffing services in their markets.
Wow.
So, yeah, we support them with all 4 things.
That's awesome. Well, how do you maintain a national brand while preserving the entrepreneurial spirit at the local level? I think they all, and by the way, I told you this the other day on the phone, I struggle with, there's so many interims, and is it this interim, that interim, they're all named the same. It's a cool way to do it because if you say you're interim, they all think that they're, part of the whole
Right.
network across the nation.
We work really hard at this because we believe that we're stronger together as a network when it comes to things like national accounts, branding, recruitment. Our brand is everything to us. So about a year ago now, we completely reworked our brand visually and some of the meaning behind it. And in doing that, we really pushed on, we're interim. We're not interim healthcare services. We're not interim home health. We're not interim hospice. We're all those things. But first and foremost, we're interim. And it's just this concept of, as a network, we can do so much more from a brand perspective. We both have brand equity. The franchisor participates in the brand equity, and every single franchisee and employee participates in the brand equity, right? So we're all in this boat together, and we want Interim to be a special place to be. We want it to be a place where, dollars are local in the market, and people who work with us know that people are earning their living, in their markets. We also have company-owned stores where we work to perfect as many things as we can. Sometimes it doesn't work. We try things, we try to fail faster, and then roll those things out to our franchisees, all supporting the brand, all driving who we are and what we're doing and the culture really that we're trying to create. It, to me, in some ways, it's the easiest part of the job because we also have just some fantastic people who want to also be there and to do it that way. So I think we all realize that the brand that we have, that there's so much equity in it for all of us. And we just really want to focus on being the very best that we can be to patients, to employees, and to referral sources and partners in every market, customers that we deal with. All of that, even suppliers and vendors. We took a very new approach on how we work with vendors. It used to be sort of a free-for-all, and we don't do that anymore. We really vet vendors very carefully, and then we help match them up in strategic opportunities where we believe they're going to make the brand stronger alongside of us. And we think that's also been a really nice change for the network.
For sure. I went to your conference this year that you hosted out in Vegas, and it was amazing. It's kind of like being equivalent to like being in the Navy or being a Marine. You're interim, right? And whether you're on the East Coast, West Coast, middle of the country, you're still a Marine. You're still part of the interim. And everybody wore the logos. They had the shirts. You couldn't tell who was who from anybody, and that's cool. It's everybody's there working on that centralized brand, and they were all proud to be there. They were super excited. It was fun. Thank you for the invitation to come. It was a blast. All right, what does success look like? And let's call it 2030. Everything's changing so fast. It's only 4 years from now. It's hard to believe 2030 is 4 years from now, but with
Wow,
AI,
yeah.
with all the rules, all the regulations. But what do you think success looks like in 2030?
I think one thing that's really exciting is that a couple of messages in what we do are really clear. People want to be in the home more than ever, and I think that's really clear. I also think that our industry proved during, the awful COVID word that we had value in the home, right? And that we could keep people safe and we could keep them, aging in place where they want to be. So I think that we have that wind is on our side. The other thing is, for the first time that I can ever remember, technology seems like a bright light for us, an opportunity to really look at the way that we have done things, predominantly like repeatable tasks, things that have been arduous for clinicians, and how can we, for the first time, really make those things better through, whether it's AI, whether it's process. And with all of that, can we touch more people? Can we do it more effectively? And can we get better outcomes? I think there'll be some, failing fast in some of this area as well. But I think it's a really exciting time for our industry that we have that opportunity. And then I think there's a lot of other kind of neat concepts that are happening. We talked about medication management earlier and people thinking about doing that differently. I had somebody approach me yesterday about, wound care and how they could work alongside us and we could approach, really significant wounds that were, limiting activities or, limiting people's quality of life differently. And, it's really exciting when somebody approaches you about a clinical opportunity to do something a little bit different. And, in the past, I think we might have been scared of that. Can we be in the home at the same time somebody else is in the home working on, a similar problem with the same patient? But I think some new ways of doing things are emerging. And to me, that's really exciting. So I see more collaboration in 2030. I see different processes that are enabled through technology. I see us being bigger. And I think I see us having more value to people in the, in our healthcare network, right? Like hospitals seeing more value in our partnership, managed care seeing more value in our partnership, payers in general seeing more value, ACOs, you name it. I think, we're right on the cusp of starting to get some of the very wanted attention that we've wanted for a long time in the industry.
Yeah, it's true. And it's, I was on a board meeting yesterday and one of the board members said there's 79, and he's on the Alliance board and all kinds of stuff. And he said there's 79 million people coming at us right now. 79 million. They're boomers that are becoming old enough that are going to need home health and hospice. And by the way, they all want to be in the home. They don't want to be in a hospital. They don't want to be in a nursing home. They want to be cared for in the assisted living or their house or their, sons and daughters, whoever they're living with. They want to be at home. They want to be with their remote control, their dog, their cat, their family, their friends, their TV. They don't want to be in some nursing home with a, bunch of IVs and stuff like that. So we got to figure out how to do it better, faster, quicker, and we got to staff it, right? That's my fear is can we get enough nurses to graduate nursing school to get out of the hospitals and come into the home and hospice communities. So it's exciting though. It's good problems to have. You have a demand. All right. So let's talk a little bit about home-based care and the future of that. What are healthcare leaders still getting wrong about caring for people in the home?
We're still really focused on how we traditionally know to deliver the services, right? And we've got to think outside that box just a little bit. We've got to collaborate better, inside our industry on things, do we see something that we don't provide from a pharmacy perspective, for example, that we can bring somebody in? If that's not our expertise, how do we bring somebody in to the fold with us to do that? If it's a certain D&E item that someone needs, how do we collaborate better? And I think channels that may open up that allow us to do that type of collaboration could be really interesting as we work on technology and figure out, how to look at the patient, as a whole. We need our payment models to catch up with some of what could be done. And I think that would be a huge game changer, for home-based care.
I also think, I totally agree with you. And I think, telehealth has always been something, or telemonitoring has been another piece. But I do 90% of my doctor's visits with my doctor via telehealth. Right? We FaceTime or Zoom or whatever you call it. And it's a secure platform, but why do I need to go in her office and sit there? And she can see way more patients and spend way more time with me. And
Right.
So it's, once the payment model figures that out and we can do more of that in home health and hospice, sure, we can still do 10 visits and go do wound care and go take care of Nana and do PT, OT, and ST, but we can also do an additional 5 visits just checking on Anna, just having a virtual visit and a phone call, just like we're doing right now. And we can communicate really well that way. So I think that the industry needs to catch up on that. The other one that I'm always harping on this podcast, I don't know if you heard it, but the ESRD patients in hospice, it looks like there's a couple of bills that Oz is trying to draft right now, but it's so sad to me to see end-stage renal disease patients that can't get on hospice because they can't stop dialysis. And these are the sickest patients in our industry. The ones that I see all the time in our Pulse product is, they're the sickest patients, and they won't go on hospice because the doctor's not going to say, stop your dialysis. And
Right.
it's really sad to me.
It's a
It's
huge
really
gap.
bad. But it's a big gap. And I think the industry is going to work on that. So what trends are you watching most closely right now? As you think about franchises and you think about, things that you can help your franchise with, what trends are you looking at mostly?
Yeah. So, we're all very closely watching some of the trends and things that, are going on with this. This moratorium and what certain states are doing and where they're going and how they're going to react. We're also really looking at the continuum a little bit, like how a patient who, comes into personal care who might really not have spent a lot of time with a PCP recently, how do we get, a little bit better picture of that patient and truly address the needs and some of the things that, that could help that patient stay home or help that patient with quality of life and collaborate better. And that whole continuum is a really big opportunity for us. So we're looking at that. We're looking at trends too that say, why does length of stay look like this in this area and this in this area? Like, what are we doing differently? So I think we are all moving to a place where data is more available than it's ever been. And it's also helping us, tell a story, make decisions, and run our businesses better. I think that's really exciting. And we're highly attuned to that right now. How do we look at all of this information and then determine, what should we be going after? The other thing is, if we have a franchisee in a market who's really good at something, let's do more of that. Let's do as much of that as we possibly can. And if they're really struggling, in a different area, then let's worry less about that and figure out, how we solve that problem later. We all have recruitment issues. We made a decision to really work on employer branding, and we've got a really nice employer branding campaign that we're rolling out, to marry up to our new brand release. So we think as a network, this is something we can really work on together and then change the behaviors a little bit around how employees work with us. And we're super excited about that, believing that, we did a survey, Tom, where we talked to a lot of nurses just to get customer insights and caregivers, therapists, and overwhelmingly what they said was not pay me more or give me more tools. They just wanted to be able to do their job. They said, we want to do care that feels like care again. And, we really listened to that. We really took that to heart. And we're revamping how we're going to do a few things around orientation, touch points. There are companies out there today that are doing really well with this. And we want to be one of those. And we really want to get to the root of what caregivers really, really want in order to, to succeed in their own jobs, and make sure that as we're trying to get more efficient, we're not forcing them up a ladder they don't want to climb, that we're taking them as far as they want to go, and that they want to do it with us.
A family member calls at 2 a.m., frightened, needing expert help fast. When you partner with IntelliTriage, a licensed nurse answers that call in under a minute, 24/7. We integrate with your EMR so our nurses have real-time access to your patient's care plans, and nothing gets missed. The result? Better patient care, less burnout, and stronger financial performance. IntelliTriage, nurse-first triage built for hospice and home health. Learn more at IntelliTriage.com.
That's awesome. And I love it that you're looking at that. And how do we make documentation burdens easier? How do we make all those things easier for them so they can really do care? The moratorium you just talked about, interesting. I don't know if you saw that today, California, or is actually last week, California, but we were all over it today. California just passed an emergency bill towards hospice. And in this emergency bill, they gave 5 days to give a comment period. And then it actually goes into effect on Monday. And they changed a whole bunch of rules. They changed one of the ones that they did, and I have zero idea how they're going to figure this out, but they're going to use Google Maps or some mapping tool that says if you can't be with your patient within 2 hours, so if you're in LA and you know how traffic in LA is, or San Francisco or Sacramento or wherever, if you can't be with your patient within 2 hours during rush hour, then you can't service that patient in that service area. Really bizarre. They're going to restrict the number of cases that a patient can be assigned, or a nurse can be assigned, to 12.
Yes.
Again, really bizarre. If I'm seeing 15 patients in a nursing home is different than somebody that's driving all over the state of California and the rural communities are going across the mountains. But this rule, which is the first time I've ever seen a state really come out with this like hammer rule, but literally emergency, they call it an emergency bill. They give you 5 days to comment on it and it goes into effect on Monday, which is like everybody's scrambling in California right now. I'm a little worried that's going to happen across the nation as we continue to have, the moratorium is causing a lot of, I don't want to say embarrassment, but there's a bunch of fraud and things like that they're trying to clean out of the system. And I think that's good for the providers that provide great care, but having to react to some of these rules, that some of them are kind of extreme and they're going to really require changes. They also said in there it's a 5-year chow process versus a 36-month old chow process. That changes the acquisition strategy. It changes the DOA strategy. It's really going to make California tough to do business in. So we'll watch it. We'll follow it. When this episode comes out, we'll already know the impact of it. But you essentially, that's something that Interim provides to all their franchises, is this regulatory oversight requirement. And
right.
It's pretty wild. And so if you don't have that, you're not paying attention, you can get blindsided about it really quickly. All right. You're the CMS administrator for a day. This is a fun question. Someday you might be, by the way. The next president may pick you. So be careful.
Oh, my.
You're the CMS administrator for a day. What major change would you make to impact tomorrow?
I think I would really get focused on the states where they could do a better job on controlling licensure, controlling, the number of people who are in this business. I think some states just did a fantastic job of that and other states did not. And I think I would really start there, because I think some of the rules you talked about in California are overreaching. I think they, some of them are good. Conceptually, some of it kind of makes a little bit of sense, but I don't think it's the state's position or the federal government's position to determine how we run a business, right? We have conditions of participation for a reason. We have, very specific state survey requirements that we operate within, federal guidelines that we operate within, and we should all adhere to those. I would take the focus away from fraud and abuse, and I'd focus more on access and getting the word out of what's really going on and the outcomes and how we could lower our overall cost by using this amazing benefit, especially the hospice benefit when used, appropriately for people. Outside of that, I think I would also really dig into my cost and my outcomes around payers. And then just, really figure out, am I doing the right thing by encouraging, more people to head towards managed care, or is the traditional Medicare benefit, were my outcomes better? And I'd really want to know. I'd really want to dig into the data, and then I'd probably I think I know where that data would take me, and I'd make sweeping changes.
Yeah, be fun.
Yeah.
You want that job?
Fun. 30 days. Let me just do it 30 days.
You want it for 30 days. Yeah. I don't know that I want that job though. It's a tough job.
I don't think I want it, but just the ability to make the impact would be, be pretty amazing.
Yeah, it would. And I think we got to fix a lot of things in healthcare. And you mentioned a bunch of them, right? I don't think Medicare Advantage is bad, but the way that Medicare Advantage pays a lot of people don't want to take it. And, there was an article that we talk about on this podcast a lot that came out. It was a study that they did that if you're depending on your Medicare Advantage payer, the quality of care you're going to get is based on the higher star rating. Providers don't want to take that payer because they don't get paid enough. And so we got to run a business, no money, no mission, whether you're not for profit or profit, you still got to run a business.
That's right.
And if you can't get paid less than you're paying your caregivers, why would you take that patient? And so those patients get sent into, less quality providers. And so how do we bring the quality up with everybody? While not just increasing the documentation burden. It seems like quality and documentation burden always go hand in hand. And it's like, come on, guys, we can do great care without having to do all this crazy documentation. So we got to fix that. Yeah. Again, I think there's a lot of things that the CMS does right. There's a lot of things that they make these over swooping, allegations towards everybody. And they know where the fraud's at. They know who's providing fraudulent care. It's easy to go figure this out. You can't have 30 providers all registered in the same apartment complex. That makes no sense. So use the data to go figure that out, but don't beat on everybody else that's trying to do good things, because you start really beating an agency up really hard with ADRs and PPOEs and all this, and pretty soon they can't care for these patients because they're doing all the documentation requirements that for additional documentation requirement you require them to submit. And so that's taken them away from doing more care for patients. So somebody's grandma's not getting care because the agency said, no, we can't staff it because we have all these people in the back office reviewing records. And so it's causing a train effect, and we're seeing it a lot. Workforce remains one of the biggest challenges in healthcare. You talked a little bit about changing what you guys are doing from employee retention and reported recruiting. Talk about that a little bit more. Tell us a little bit more about it.
Yeah, we decided to really do a little bit of research and say, how are we missing here? What are we missing? We've also put great tools in place for our franchise partners to respond, quickly and effectively to inquiries for people who are interested in working with them. And we measure the responses and we publish it. And, in the franchise network, you have a lot of entrepreneurs, and entrepreneurs are competitive. So I think, they definitely compete against each other to make sure that, whatever you're putting out there, they're doing it better than the next person if they can. So I think just a little bit of competition in our network has even driven up our response time a little bit. And at the end of the day, driven our results. We have a great talent acquisition team. They've been, working on on how to train on the ATS. We have, I think, almost 94% of our network using the same tool, which is also great because when you have that, you've got access to reporting, you've got data, you've got the ability to make changes and everybody get on board. So we're super excited about where we're headed here. And we also have this new branding campaign that we're starting to launch, and we're having franchisees launch it locally in their markets. It's digital, it's streaming, it's print, just a whole lot of different ways you can go. If you don't want to buy a TV ad, you don't have to. If you want to, use all social media, go for it. We've laid out everything that a franchisee could possibly think of in this campaign and given them the opportunity, given them the tools and the opportunity to get going, and they can personalize it, for their communities. And so far, that's something that we're starting to just now roll out and test. And we're testing it in our company-owned care centers, and we're super excited about the results thus far. We think it's different. I called it a little edgy. Sure. And our marketing team said, no, Rexanne, it's not edgy, but, it's attention getting. So, that's a little different in our industry. A lot of times you see, a lot of these campaigns are all about the care you provide, or they're all about, working and being flexible. And I think this one kind of talks about a little more, you're not going to do it alone. And if you're tired of doing this and you're tired of doing that, here's something new to try.
So that's an advantage that a franchisee has. And it's super interesting to me so if I start my own home health agency, and, you can start one for, a few thousands of dollars, I don't know how much it costs, versus buying a franchisee, but I have to go create all that. I have to create all my content. I have to go build my brand. I have to come up with a name. I have to do all those kind of things. If you buy a franchise, that's what comes with it, right? You get access to all these different tools that are available to you, the support network, the people that are going to train you how to be, if you've never done home health or home care or hospice, they're going to teach you how to do that and help you with the rules and regulations, technologies. I mean, all those things are super important, how to grow a sales team, how to run a business. So that's the advantage of what you're selling really is. We're giving you the starter kit, and then we're going to increase the starter kit and continue to evolve the starter kit. And then it becomes, your lifeline or your SOP for how to run this business. It's cool. It's cool. I never knew all that you guys were doing all those kind of things. It's awesome. Where do you see technology making the biggest impact in home-based care over the next 5 years? We talked a little bit about this, but
I think it will be in two places. It'll be in these very repeatable tasks that we've done, and the bigger your volume got, the more people you needed to sit in a chair and do the repeatable tasks. So, things like intake, things like, getting your billing out the door, your collections, a lot of these auth and eligibility, like all of these areas that I think we can start to look at them and figure out, how do we do this more effectively? And it's not necessarily about doing things with less people. There is an element of that, but it's also more about doing them really well and doing them in a way that, you can expand your business and you can put those dollars where you want them, like in the field, in the opportunity to do more for that caregiver who wants, the LPN who wants to become an RN. Like, how do we free up dollars to make working at your business just such a better place for people? So I think there's a ton of opportunity there. And then I think you're going to see an impact to make the clinicians' lives better. I think they're going to also, like, repeatable tasks, things that they've had to do over and over and over, maybe document it 3 different places, 3 different ways, for them not to have to do that. And I think those are going to be some of the biggest impacts that we see.
Yeah, I'll give you an example of that. So I was working with an agency a few months ago, and they have the, nurse goes out and does a starter care. She answers all the OASIS questions, the physical assessment, medications and all that, sends it into the back office. It gets to the review evaluation documentation stage. Somebody goes in and reviews that entire record, and then they push it along to the edit approved 485. And somebody else goes and reviews what the nurse put in the starter care, what the reviewer put in, and then they go review it again. And then it goes over to OASIS, whether they offshore it or they do it there, and they read the entire chart again and make edits to it again. Then it goes to coding, and coding makes all those changes. Then it comes back and somebody else reviews it again. And so we've just spent, hours of time reviewing the exact same chart over and over and over. Tool that AI can do. I mean, absolutely, AI should be able to summarize that document for you. And the other one that I've seen recently that I think is really amazing is if you're a nurse and you've never seen the patient before and you're on visit 7, you have to go read the chart of visit 1, what was in the starter care, what are the interventions and goals, what's going on with this patient. Then you got to read what happened on visit 2, visit 3, visit 4, visit 5, and then now you're on visit 7. What do I need to do? And most of the EMRs out there don't make that easy. These new tools that are out there that AI can go and summarize that record, make sure the starter care was done, summarize what the PT did, the OT did, the aide did, where's the wound, all those kind of things, and essentially give you a profile of that patient as you walk in the door. You don't need to read the entirety of the record. Well, if I have to read those records, 7 records, it's going to take me 30 to 45 minutes minimum if you read fast. If it can give me all that in one document, then as a nurse, when I'm walking into the home, I know that, Nana's bedbound. She has a wound on her right leg. She's got high blood pressure. She's, maybe had a UTI. We've got to check that. We need a PTI-NR because she's on Coumadin, all those kind of things. I can really quickly do all those things versus having to go read the entirety of the record. And so what we're asking nurses to do today without AI, without all those tools, is go do that, right? We're saying, hey, you got to do a good job taking care of this patient. Even though you've never seen them, go spend 30 to 45 minutes doing that. I could go do another visit in 30 to 45 minutes. So I think those are the tools that I'm seeing. It's not do less. It's we'll be able to serve more. 50% of all patients that get discharged with home health instructions don't get home health. Why? That's my question is why? Why would you not? The doctor said you need home health. You didn't adopt it. Why? Blows my mind. It's usually a staffing problem, or it's we didn't get them to the right person at the right time. The other one that I'm really thinking the industry's focusing a ton on, and this is where I wish CMS would actually do something, is when the patient gets out of the hospital, the average time, it's getting better, but it was 6 days before we got a nurse into the home to admit the patient. And that's paperwork, that's authorization,
Yep.
that's getting Medicare Advantage to say yes, all that stuff. For 6 days, Nana got out of the hospital and she didn't have anybody in her home with her. There's a lot of things that are going to happen in 6 days, especially if she just had a hip replacement surgery or shoulder surgery or she just had a stroke or, all those kind of things. Sure, she's not hospital eligible anymore. She doesn't need to be in a hospital. We sent her home and nobody showed up for 6 days. That's terrible. I think we got to get faster, better, quicker at that. And again, AI tools, processes can help us get to the patient quicker. It's a gap. It's a real gap. And when you start really digging into the data and why these things are happening, there's a reason for every single one of them, but it's not a good reason. Scary. All right. As the CEO, how do you decide when you do an early adopter versus let software or technology mature before you adopt it?
This is a little like learning the tango, right? So you want to be really good and graceful at it, but it can be really clunky if you don't have the right partner, So I think
That's right.
yeah, I think that this is staying really present and deciding what you think your priorities are. One of the things that we're very, very focused on, because it's really easy. There's a lot coming at us right now to get excited about a lot of different things. But we're trying to say, where do we think we really have the best opportunity for impact? And some of that impact is going to be small. Some of it's going to be big. But, and where do we think we can get the best process wrapped around that and the best ROI for the owner that's going to be buying that service? So we do have a little bit of this fail faster mentality. Like we want to try things. We want to figure out if they work or not, and then be able to regroup and figure out the next thing that we want to do. But we also really want some wins. So we're looking at areas that we think we can get those wins. Some of them will be small, some of them will be big, and we're just being very maniacal about who do we want to do that with? How can we measure it? What will success look like? And then let's go, right? So we are really focused on execution around the things, that we think are going to make an impact. We won't win at all of them, and I don't think you ever do. We're also trying to be far more present, Tom, with people, even like yourself, and people we can learn from who do know more about tech than we do. We know we're not the tech experts. And I know that we can go hire some really smart people, which we have and will continue to do. But I can't build tech expertise as fast as I can learn it, ingest it, and figure out how to use it with the right partners. So we're really, really also focused on that. What does that look like? How do we do that? And how do we, walk away from all that knowing more? There has to be, in everything a franchise partner does, there really needs to be an ROI. There needs to be, if they're going to spend money on top of what they're already spending, they've got to be able to be more efficient or do more volume or say there was truly an ROI. Either quality got better, which made my star ratings get better, which made my reimbursement get better. Those things have got to be there. And if we can't automate just for the sake of automating, and it costs more. So we're really, really focused on that.
Yeah, ROI just doesn't have to be money either. It can be nurse satisfaction, quality scores, outcomes. A lot of times I hear ROI is pure, you didn't save me enough money. And that's coming from the CFO. And I'm like, yeah, but you're getting more patients because of this, or you're getting, your quality scores went up. And so I think you got to do the subjective and objective ROI. But money's a big deal, right? I can't afford to continue to invest in softwares that, don't produce for me. I agree with that. All right, let's jump over to hospice. Are we doing enough in the industry to educate families around hospice at the end of life?
No, I think we're doing better, but we're not doing enough.
I agree.
Yeah, we're not doing enough. I actually think it's interesting. I don't know how many people actually know this, but there are, I don't know, probably 12,000, 13,000 home health providers, registered with CMS. We have half that number of hospice providers, right? And then we think we have this huge fraud, waste, and abuse problem. We do have a fraud, waste, and abuse problem in some very specific areas of our country. And like you said earlier, we know where it is. We know what it is. We need to get very focused on that. But we need to keep educating people about this amazing benefit and the value of this amazing benefit. The one thing that I think if I could say to people the most about hospice is it doesn't mean necessarily that you're dying. There could be that could be the event. That could be, but it doesn't, if something changes, you're not locked in. You can come on and off of hospice as long as you qualify for the benefit. If you improve, you can walk away from that benefit. So there's nothing to be afraid of. I do think there's a huge opportunity to educate people, around that, and to educate families around that. We just launched a new nationwide program for hospice that we're extremely excited about called Finding Peace. And I wish that's what we called hospice instead of calling it hospice. Because if you can help people at one of the most troubling times of their lives and their families' lives find some peace about their medical experience and their medical care and what they need, and get good counsel, and be able to do that without, being in a hospital room or being necessarily in a long-term care facility, keeping them where they want to be, then I think that everything gets better. So, no, I'm really passionate about this topic. I don't think we're doing enough.
Yeah, I agree. And I worry that with all the noise in the news around fraud and all that it's discouraging people from putting their loved ones on hospice. And it's going to be sad. I mean, if you're in and out of the hospital and you die in ICU, that's the worst place to die. And I worry with the negative press that hospice is getting right now, that it's going to become harder and harder. So, I think we have to do a good job. The legit providers out there have to do a good job of continuing to educate people around this is what the hospice is. And you're right. You said it. It's not a death penalty to get put on hospice. It means that we're going to do a different level of care. We're going to treat you as a patient. And we're not, trying to cure you, but we're going to try to keep you alive as long as we possibly can, and make that the best experience it could possibly be for you and your family. And it's important. I worry about, though, that the negative press is a little bit becoming too negative. Okay, a few more questions. Some fun ones. Let's get into some fun questions. Like hospice questions sometimes make me sad. Beyond people that know Rex as the CEO, I know Rex as a friend. What are the things outside of work that bring you the most joy? And what would people be surprised to learn about you?
Yeah. So, I guess I would say I'm in love with a lot of the simple things. I grew up in the mountains in North Carolina, love the mountains, love the rivers and the streams. My husband's an avid fisherman, so anything, outdoors is a ton of fun. We are, we're a dog family. We've got everybody in our family has Labrador retrievers. So, we like throwing a ball, chasing a ball, running in the water, you name it. So I think a lot of the simple things really, garner a lot of joy for me. I love gardening and creating, things outside. So that's a ton of fun. And, I guess what would people, find surprising? Maybe that in a lot of ways, I don't feel like I have a tough time relaxing. Like I want to be doing something, I like to, whether it's, taking on a new project, learning something new, meeting people, that all that stuff kind of fills my cup. Right. So, but then I also like my quiet time to do some fun things as well. So I think, I probably just never stop. Maybe that's not surprising, but
That's surprising to me, but I know you pretty
there's
well.
always something going on. Yeah.
It's always something going. I'm the same way. I don't want to slow down. I don't want to stop. Every day I like, all right, what's the plan? What are we doing?
Yeah. And I've got these grandbabies that are a ton of fun too, I got to say.
I don't have grandbabies yet, but someday we're going to have some. What advice would today's Rexanne give to the younger version of yourself entering into healthcare?
The advice would definitely be don't major in the minor things, right? Like there's a lot of times I think throughout my career, I got really hung up on things that if I could have just said to myself, is this going to matter 3 weeks from now? I probably would have maybe a few less wrinkles on my forehead. or, a few less sleepless nights. So I think, really trying to keep your eye on the things that really, really matter, really understanding what what your priorities are with people, with, the people that you have responsibility to, and, make decisions that are bold, but worry less about, the outcomes of some of those things, and just, keep plowing forward.
Yeah, that's great advice. I'm guilty of that too. Like, how is this really going to make revenue or help us grow or help us do more compliant things? And, you end up minoring in something stupid it's spending a lot of brain power and energy and heartbeats and all that on something that really doesn't matter. I get it. All right. When your career is finished, you're probably going to retire the last time. I think you've retired before, so you're going to retire for the last time at Interim. What do you want people to remember you as?
When I came into this role, my goal, really simply put, was I want us to be a better franchisor. Now my goal is kind of morphed a little bit, and I want us to be the best franchisor. And I want people to say, like, she really cared about me. Like, she knew me, and she helped facilitate something, or, remove a roadblock, or help that next person in my family that I wanted to do this job. I'd like to leave the kind of legacy where people say, either she did it herself or she did it through others in her team, but it happened under her watch and under her leadership. That would be the ultimate, I think, legacy to leave here.
It's awesome. That's really good. All right. So if I'm an entrepreneur watching this video and I think I want to get into the home care, hospice, or personal care business, and I want to call Rexanne and the franchise, how do I get a hold of you?
Well, my favorite saying is, if you're thinking that, why not Interim? Right? Why would you think about anything else? So it's really easy to get a hold of me. I'm on LinkedIn. My phone number's out there. Google me, call me, write me, send a pigeon, do whatever. I'm going to call you back. I'm the person that's going to call you back. We're going to talk about it. And if it makes any kind of sense, we're going to do it. We're going to get you in an Interim franchise. Tom, I called you when I was in this job, maybe 3 months, and said, I've got an Interim franchise you can buy.
You do. And if I wanted to be in the home health and hospice business, if I thought that was where I would have bought it. But unfortunately, in Minnesota, I spent all my time in Scottsdale, and that'd be really hard for me. But my kids are all still about it. They're like, "Why didn't you do that? We could run that
there
too."
You
like, yeah, right.
We might get you yet.
Yeah. Rex, it's been an absolute pleasure having you on here. I love hanging out with you. I love spending time with you. I'm sorry we couldn't drink wine on this, but we'll do that again. I owe you a glass. And thank you so much for sharing your story. You're a wonderful person. And I know Interim's in a way better place because you're in charge, and super excited of the team you built and all the people that are around you that get to have impact of what you're doing. So thank you.
Yeah. Thanks, Tom. Thank you for all your support. Thank you for the opportunity to have, a little bit of time to tell our story and a little bit about what we're about. And don't be a stranger. We're going to need some help. So we'll be calling you.
For sure. Thank you.